Chapter 7 Bright's Disease Case Histories. Bright's disease is defined as a morbid condition of the kidneys. The term is generic and includes several forms of acute and chronic disease of the kidney, usually associated with albumin in the urine and frequently with dropsy and with various secondary symptoms. Its causes are said to be the effects of fever, especially scarlet fever, exposure to wet and cold, as a contributory cause only, the action of irritating drugs, alcohol, etc. Dr. G. Johnson found, by an analysis of 200 cases, that intoxicating drinks caused 29% of all cases and 12% arise from scarlet fever. Dr. E. Harris Roddock, MD, Wade Macomb. Agreeing to the biochemic system of medicine, G.W. Carey, MD of USA, Bright's disease is primarily caused by a lack of phosphate of calcium in the body. He writes, when the phosphate of lime molecules fall below the standard of quantity, the albumin with which they are associated with is of course thrown out of circulation, and if this albumin reaches the outer world by the kidney route, a case of albuminuria is developed. According to the practitioners of the system, the chief remedy therefore is phosphate of lime, administered in infinitesimal doses as nature would supply it in such foods as are not denatured by the refining process. In other words, Bright's disease is caused by deficiency diet, a diet lacking in the essential mineral salts to keep the blood and tissues healthy. To quote Dr. Carey again, biochemists have clearly demonstrated the fact that when a deficiency of the cell salts of the blood occurs, the organic matter with which those salts have been associated with is thrown out of the vital circulation. It is worthy of note that although the biochemic system of medicine claims to be able to cure deficiency diseases, it stresses the fact that it cannot cure the effects of gormandizing. The incidence of Bright's disease dates back to early times, but it considerably increased during the last century and onwards, and in its worst forms has been the cause of many untimely deaths. It is a singular fact that during the first 3 years of my career as a urine therapist, although I had contacted many cases of cancer, diabetes, consumption, and valvular disease of the heart, not once until 1920 was I confronted with a genuine case of the disease, of which dropsy is but a symptom. Dropsy occurs in diseases other than Bright's disease. My first case was one of the most testing I have since experienced. Here are the particulars. Mrs. C is in the early 40s, given 2 days to live by the doctors. Breathing somewhat difficult, urine very scanty, thick, and looking like a mixture of blood and pus. She had been a very fine specimen of womanhood, judging from photographs taken a year or so previously. Her normal weight for a woman of her height had been 144 pounds, but when I was first called in to see her, she weighed roughly 280 pounds, 20 stone. In spite of the doctor's verdict, however, I did not think that she looked like a dying woman, though to say the least, her condition was a very serious and painful one. Fortunately for the case, she had 2 elderly and humane nurses who had little faith, notwithstanding their own profession, in drug and medical treatment. Of these 2 women, I can never speak highly enough, and of the broad-minded manner in which they gave me their full cooperation. Judging from the contents of the medicine table, it was hardly to be wondered at that they had lost faith in drugs, for there was such an array of bottles that my indignation was aroused by the way the unfortunate patient had been experimented on. Nevertheless, on the strength of what I had seen in far worse local conditions of heart affections, breathing difficulties, stasis, etc., I promised her speedy relief from her most distressing symptoms, and predicted that she would find her ability to void urine increase at least 100-fold within 1 week. So powerful is the effect of drinking one's own urine, which serves to break up congestions in every part of the body. My prediction came true. Within 4 days, the flow of urine had increased from a bare 2 ounces. It was a very high in aroma, hot, thick, cloudy, and full of casts, to about 200 ounces in 24 hours. Moreover, it began to change into a much clearer and far more freely expressed liquid, gradually approaching the appearance of rainwater. By the 4th day, after drinking every drop she passed, it was practically tasteless, free from odor, and in no sense of the word objectionable. In addition to the urine, Mrs. C was permitted to take, by sipping it, as much tap water as she desired. This amounted to about 108 ounces in the 24 hours, although I should add that after the 3rd day, thirst had become well nigh absent. From the 4th day onward, I had lost all anxiety about the case. and except for short, infrequent visits, left the treatment in the hands of the two intelligent and helpful nurses. By the 23rd day, the patient was showing such signs of complete recovery that one of the nurses begged me to try the effect of a little grated raw carrot juice flavored with lemon. The result was a setback. Within 2 hours, a rash covering a considerable area and attended with much irritation appeared on each arm. At the same time, the flow of urine was impeded, and there was much swelling and irritation in the abdomen. Clothes soaked in one of the nurse's urine were placed over the abdominal region, whilst both arms were gently rubbed and bathed with the same fluid. After 4 hours, the abdomen absorbed the moisture from the urine packs, and the flow of the urine recommenced. This was taken internally, and the following day, except for the rash and irritation, the patient's condition was the same as before the carrot had been eaten. As for the rash, it took nearly a week before it vanished. One of the features of urine therapy is the rubbing of the patient's whole body with urine at given intervals for 2 hours at a stretch. That is, provided the patient is not too weak and emaciated to stand it. Mrs. C was therefore rubbed twice a day for 2 hours with one or other of the nurse's urine. By the 48th day, the patient had so far become normal that on the 49th day, we broke her fast by giving her the juice of an orange at noon and a whole orange to suck at 4 p.m. The same day she voided and took urine freely, which meant that all was now in order. At 6:30, she was given a small piece of steamed fish and 2 steamed potatoes in their jackets. She weighed now 119 pounds. Next day, she had 2 small meals, which she was advised to Fletcherize. That is, chew to pulp before swallowing. In a week, she was on her feet, dressed in her clothes of the previous year, and able to walk easily from room to room. Although recovered, she kept up the practice of taking her own urine, as also rubbing it into the body. The most important areas are the face and the neck, with astonishing results on the skin, hair, complexion, and her general appearance. Indeed, urine is the skin food par excellence, as also the remedy for every kind of skin disease. And here ends the long case history of Mrs. C, who was given only 2 days to live. Incidentally, both her husband and the 2 nurses became strong converts to urine therapy, and I may add, to a well-balanced as opposed to a denatured diet. Mrs. C's case attracted much attention as far as the lay public was concerned, but not, as I then innocently hoped, from the medical fraternity. For, as Dr. Freud, the discoverer of psychoanalysis, has pointed out, no matter what evidence, many people only allow themselves to believe what they wish to believe, and likewise they disbelieve what they wish to disbelieve. All the same, there are extenuating circumstances where the medical profession is concerned. Until a lot more spade work has been done to put an end to prudery, the chances are that if a doctor told his patients to fast and drink their own urine, he would merely be regarded as mad or disgusting, and the patients would immediately seek the advice of some other physician. Besides, why do most people seek medical advice? In order to be told how to counteract the effects of their self-indulgences. If one doctor tells them they must give up this and that, then they go to another doctor who tells them that they need not give up this or that, and being delighted with his advice, follow it very often to their own undoing. Enough said. Mrs. C's case was instrumental in bringing the case of Mr. B, whose condition had also been diagnosed as Bright's disease. Mr. B had for years subsisted on the unusual ill-balanced deficiency diet, rendered with even more deficient by a non-conservative cooking, and rendered more tasty by the adjunct of condiments. He was not a big eater, but he drank some 8 cups of tea a day and smoked about 25 cigarettes on average. When he came to me in 1920, he had been under 2 doctors for some time, during which period his weight had increased from 280 pounds to 420 pounds. Like Mrs. C, he had finally been given 2 days to live. In June 1920, he began a fast which lasted 49 days. By the 4th day of his penance, he was passing water as clear and as tasteless, almost as rainwater, and his swellings began to vanish with astonishing rapidity. He had been anemic, but at the end of the 7 weeks, his anemia had disappeared. His weight was now 105 pounds, and he looked in every respect as young as he had done 20 years before, as his photographs showed. Mr. B broke his fast in much the same way as Mrs. C had done, and like her, became a convert to urine therapy and a properly balanced, if frugal, diet. That is, he gave up denatured food and continued to drink his own urine daily, with most gratifying results. In the same year, more cases came into my hands. Mr. W, 75 at the time, Mrs. L, 38, Mrs. B, 55, and also a boy of 11. Each case presented features worthy of recital at length, but brevity must suffice. Mr. W, in spite of his age, fasted 53 days, which serves to show that age is no obstacle. Mrs. L, 42 days. Mr. B, 60 days. In the case of the boy, a fortnight proved sufficient to effect a cure. All the cases were attended with the same happy ending as that of Mrs. C. And here let me add that the policy of forcing sick people to eat in order to keep up their strength, under quotes, is in my opinion responsible for thousands of untimely deaths. Food cannot be assimilated by a sick body which is already full of obstructive matter. The only food, under quotes, for sick people is urine, seeing that among its other functions it replaces tissue in a manner nothing else can do. As for drugs, many of those poisonous ones employed have serious cumulative effects for which there are no antidotes. After 1920, during the next 2 years, I had over 30 cases of Bright's disease and other affections of the bladder and kidneys to advise upon, and in no instance did it take longer than from 4 to 14 days on urine fast to restore normality and a satisfactory state of general health. These cases have yielded to treatment so much more readily than the ones aforecited. I classified them in my notes as A, B, C cases. I will briefly cite one more of the serious cases. Man of 60, after 2 years constant medical supervision and treatment for heart, developed Bright's disease. Finally, given up by his 2 doctors, specialist was called in. He was the victim at the stage when his eyes were staring from his head, tongue was dreadfully swollen and protruding from his mouth, whilst his lips were 3 times their normal size. Specialists said that the case was hopeless, nothing more to be done. I undertook the case. Patient passed 40 pints of water 5 days later and returned to business in 6 weeks, cured.